Hi, and welcome to today's lecture in the Policy and the Pandemic series, State Responses to COVID-19, State Reputations, and Long-Term Economic Health. Hi, I'm Whitney Sheridan, Director of Communications for the School of Public Policy in the College of the Liberal Arts at Penn State. While the economic pain from the coronavirus and its response grow more intense by the day, surveys have shown broad support for stay-at-home policies and concerns for restrictions lifting too quickly. For lawmakers, the focus has been on balancing public safety and economic well-being. But how will their decisions impact the health of the economy in the long run? Before I introduce today's speaker, I want to set a few ground rules for our conversation and let you know about some additional events that we'll be hosting as part of this series. We encourage your participation today and invite you to type your questions in the Q&A box at any time throughout the discussion. I want to remind you that your registration for today's webinar includes your attendance for any and all of the events in our Policy and the Pandemic series. We hope you'll join us next week when Selena Ortiz, Assistant Professor of Health Policy Administration and Demography, will discuss her recent research on Pennsylvania's local officials' response to the coronavirus. And now I'm delighted to introduce Chris Witko, Associate Director of the School of Public Policy and Professor of Public Policy and Political Science at Penn State. Professor Witko's research focuses on how public policies shape and respond to economic outcomes such as unemployment and inequality. Hi, Chris, thanks for joining us.
Well, thank you. Appreciate you doing this.
So, Chris, you say that economic implications of COVID public health actions are important everywhere, but perhaps more so in the US. Why is that?
Yeah, I think the reason why the economic implications are so important in the US is we have a very weak safety net compared to other countries, just in general, in terms of unemployment benefits, access to health care. Most people are dependent on jobs, for instance, for health insurance. And then if you look at the specific economic policies and that were put in place for workers in the wake of the pandemic, they tend to be weaker in the US compared to most of our other affluent peers. You know, in other countries, they're doing things like paying 90% of the wages of employees so that they don't get fired and things like that. And we don't have, I mean, there has been some additional unemployment benefits and things along those lines, but not like most other countries that are wealthy. So it's really important for American workers to have jobs more so than in other places.
Your recent research examines how pandemic responses may impact state reputations, asking how people evaluate job opportunities based on how aggressive governors have been on mandating their social distancing policies. So what motivated you to ask this question, and what did you find?
Yeah, so Michael Nelson, who's a political scientist here at Penn State, he's my co-author on this paper, and we had been thinking for a little while about how do kind of state policy actions and actions by political figures in states shape perceptions that people have of states, and particularly how willing people would be to relocate to states. And that's really important in the United States because states compete to have young, talented, educated people to come and contribute to their economy. If you look at states with low population growth, old aging populations, not a lot of young people moving in or young people moving out, it's a recipe for economic problems down the road. So we had been thinking about that question for a while, and we kind of wanted to think about it in the context of these responses to the pandemic when we saw what was happening in certain states. And you and everybody else who was watching this, if you're kind of following the public health advice and you see the states that really weren't appearing to take it very seriously, you kind of start thinking, wow, I'm glad I don't live there. And, you know, if you think about it, what are the long-term implications of these decisions going to be for people's perceptions of states? We thought they might be really important. Now, if you ask people, what do you think of Alabama? What do you think of California? What do you think of, they're gonna give you an answer, but it's really gonna just be based on things they've been thinking about for years. I mean, you think Alabama, you think a certain thing. You think California, you think it's a certain thing. We wanted to know, how are these pandemic actions going to affect people's perceptions of states? And a kind of indirect way to get at that was to give people basically compare job offers that we gave to survey respondents. We surveyed about 1,000 people in April. And we did something called a conjoint experiment, which allows you to put two competing job offers up against one another and let the people doing the survey experiment basically pick which job they prefer. We varied a lot of things. We varied salary, we varied company culture, we varied the size of the town, all sorts of things like that. But one thing we also varied was the governor's response to COVID-19. And it could have been the governor issued stay-at-home orders, the governor devolved things to the local level, the governor recommended small gatherings and social distancing, or the governor did nothing but issue a proclamation thanking healthcare workers. And so we gave people a bunch of different pairs of jobs, and we let them choose through which job do you prefer out of these two. And what we found was if you take the 1,000 survey respondents and the number of comparisons that each survey respondent did, so over thousands of pairs of job offers, people were more likely to take a job after you control for salary, after you control for type of city it's in, company culture, that sort of thing, more likely to take a job or prefer a job in a state where the governor basically acted aggressively to mandate social distancing. People were about 7% more likely to take a job in a state, take a job, I say, but these were hypothetical job opportunities in a state where the governor mandated social distancing. We found that the effect was stronger among Democrats, but it was still there for Republicans as well.
So one of my questions was going to be, isn't salary or compensation the most important consideration? But it sounds like this was in addition.
So
right.
salary is salary is the most important. You could probably get most people to, there's an amount of money that most people would take to move to a state where the governor did a really terrible job during a pandemic. I know I could probably be bought, and I suppose most of us could. But once you adjust for that, people are still more likely to go to the state where the governor mandated aggressive social distancing. And if you think this through, now, right now, nobody's actually, having two job offers that they're thinking about, right? Mm-hmm. The economy's bad, probably very few people in that position. But down the road, people are going to start to have choices, and particularly young, educated, mobile people are going to start to have choices. And where are they going to go? Well, maybe they'll go to the state that offers them the higher, where the job has more salary, but that means employers in that state are going to have to pay more to get the same level of talent, or they're going to have to accept lower talent. And you might say, well, these are hypothetical job offers. Who knows what people would actually do? But there's actually some research which we cite in the paper, and it actually seems in a lot of these experimental contexts that actual behavior reflects how people respond to these experimental scenarios in a lot of cases.
So I did see a hand raised a little earlier. I want to remind people you can ask questions anytime using the Q&A box. So I want to encourage that. Chris, you were studying the reputation of these states and how the governors contributed to that based on their public health decisions. So what effect does the reputation have to the economic performance for employers in the long term? And can these employers or can the states do anything to maybe repair these reputations in any way?
Yeah, so states do a lot. I mean, governments do a lot to try to make their states attractive to different people, with everything ranging from tax policy to recreational facilities like bike paths, nice beaches, and so on and so forth. There's many things that states can do. And so these pandemic responses are really only one factor that people would weigh in. They're quite a salient factor, you might say, especially right now. So we do think that people will take those seriously. We can't say for sure in 10 years people are going to be thinking about this, particular responses to the pandemic, but these responses to the pandemic and the responses to other things that states do. I mean, if you saw like the lines in Georgia last night to vote, do you want to go live in Georgia? I don't. All of these things lead to perceptions in people's heads about different states, and people who have options, people who are educated, entrepreneurs, talented, they do have options about which states they want to live in. and they're going to be less likely to live in states that engage in policy activities, particularly in these very visible, highly salient episodes, like in fighting a pandemic. Like everybody, I'm guessing, who's on this this call here knows what the governor of Florida did as opposed to the governor of Ohio. Well, you're not going to just forget that in 2 months, right?
Well, let's talk about that a little bit, because, you know, one of the things that we've seen throughout this entire pandemic are a lot of our state leaders, our governors have been some of the most visible people throughout this entire pandemic. And you talk about this in your research. They've become some of the people that we've seen the most. How have they measured up? And we've definitely seen we've heard a lot about the short-term economic implications in terms of the crisis. Why do we tend to focus on that?
Yeah, well, as far as the governors, I mean, they have been, you know, I've been following state policy making for years and worked in state government. And so it's great for me to see such a focus on state government. I wish there wasn't such a reason for it potentially, and the federal government was doing a little bit more in this case. But, you know, because the federal government hasn't done much, the states have really been central to what's happening here. And in particular, the governor, because governors in most states have pretty considerable emergency powers. They can do things like here in Pennsylvania, right? The stay-at-home orders were issued by the governor. There wasn't a law passed by the legislature or anything like that. In addition to that, a lot of the governors have had press conferences. Some of our neighbors to the north, New York, have grown very aware of Cuomo's dealings and such.
Mm-hmm.
So they've been really highly visible during this. And so people are paying attention to what they're doing. And what was the last part of your question? I'm sorry.
Well, I actually, this is kind of playing up on that. One of our faculty members in the School of Public Policy, Andy Fenelon, this is about the short-term implications. Is there concern that any investment that states make in reputation will be enjoyed after the current governor or legislator are out of office?
Okay.
So getting them to care more is kind of tough. And this is about the electoral, you know.
So yeah, your second part of your question was about the incentives, essentially.
Mm-hmm.
So yeah, politicians are naturally focused on the short term, or the short-ish term, right? The next 1 to 2 years. I mean, here in Pennsylvania, I don't think Wolf can run for re-election, but certainly politicians that can run for re-election are considering their next election campaign, or maybe if they want to run for the Senate or something else, they're thinking about that. So there is a definite amount of short-term thinking among elected officials. And then there's also, added on top of that, during a pandemic, I mean, people are thinking about life and death. They're thinking about these kind of really fundamental issues. And so you're really focused on the short term. I don't know about you, but in the first couple of weeks of the shutdown and all that, I was not necessarily focusing on the long term myself. So that's a natural thing. So it's a great question. How can we get governors to think about the long term reputations that they're creating for their states with these current policy actions, when all their incentives are to try to get their economies up and running as soon as possible for electoral purposes, but also really for budgetary purposes? And a lot of state budgets all the state budgets are going to really be damaged by this. So they have a lot of incentives to really focus on that short-term economic goal, and not really many incentives to think about the long-term economic consequences of these decisions. You know, what can change that? Maybe somebody will slip this paper that we wrote to a couple of governors. I won't hold my breath on that. So honestly, within the context of everyday politics, there's not a lot of incentives for people to think about this. But, you know, things like the business community need to be thinking about this. Other advisors to the governor need to be thinking about this. You know, we're weighting public health against economic health and thinking about the short term, but people also need to be thinking about the long-term consequences. And I'm sure there are folks who are.
Mm-hmm. We have some great questions coming through. Here's one. Could the actual government response to COVID-19 and the state of the survey respondent have some impact on how they responded, either to reinforce the action of their home state, reaffirming what seems to be normal in their environment, or to oppose it in some sort of grass is greener bias?
Yeah, I mean, we did a national, as far as I know, I mean, it wasn't all drawn from one state anyway. It was a national sample, and so it wouldn't be dependent on just people in Pennsylvania, their perceptions of what the governor did. I think, though, what we saw is the vast majority of people that we surveyed were concerned about the coronavirus. At that time when we did the survey, there was a high degree of consensus certainly among public health experts about the need for stay-at-home orders, basically mandated social distancing. That was really popular with the public, like 75%, 80%, if you look at the polls, particularly at that time, were in support of these measures that were being taken. Mm-hmm. And most governors were actually doing these things. There was a handful of governors that weren't, but many governors were doing these things. So I don't think it would be dependent on the particular state that people were in at that time. Now, as things began to open up, say within the last couple of weeks, you might have been, if you're in Pennsylvania and you were on lockdown until very recently, you might be thinking, wow, I wish I lived in South Carolina or something like that. But at that time in particular, I would say no.
So while you say that the majority of people are in support of measures like stay-at-home orders, there were some protests against these in many states, which does indicate some opposition. Tell us a little bit about that, and what does that mean in terms of research like this?
Yeah, there were some protests for sure. They tended to not be too big. I mean, they did get a lot of media attention, but there weren't huge numbers of people. I mean, obviously, we're seeing massive protests and demonstrations in the last week and a half or so here, and the size of those just can't be compared to the small size of the coronavirus protests. So we need to keep that in mind. Yeah, there were protests, but really it wasn't a lot of people. And if you look at the polling, people were pretty supportive of the social distancing measures.
Okay. Here's one. Somebody wants to ask, do you believe it's the responsibility of the federal government to respond to this pandemic, or should states have absolute authority over their response? This is interesting considering a lot of legislators have been challenging the authority of their state governors to have that authority in emergencies.
Yeah, so there's that's one question, like how much power should the governor have within a state? Mm-hmm. And, it's been well established for a long time that during these types of emergency periods, governors have a lot of power. And that's, maybe that is something that's being revisited in some states. As far as the balance between the federal government and the state government, I mean, one thing, there's reasons why you need the states to do things. First of all, there are different conditions across different states. What was happening in New York in March was not in any way the same thing that was happening in Florida or South Carolina. So it does make sense to have the states have some discretion in how they respond to this. The other thing is the governors and the state governments are the ones that have the ability to mandate the closure of particular businesses and things like that, to mandate social distancing. The president does not have that authority. Or it's not obvious that the president has that authority, let's put it like that, or that Congress can make laws along those lines. Certainly it would be a harder argument to make. So there's reasons why the state governments needed to be maybe not on the front lines, but definitely intimately involved in what's going on. I think what was striking to a lot of observers of federalism is that the federal government, not only did they not want to take the lead, it seemed like they didn't even really want to play a very useful supportive role. So in terms of using the Defense Production Act to ramp up production of PPE and things like that, that was not used aggressively. There's been some funding, just blanket funding sent to the states for testing and things like that, but a lot of people say there should be a lot more. So even if you're going to have the states kind of take the lead role on responding, there needs to be a pretty solid backstop and a lot of support from the federal government, and we haven't really seen that. So I So to answer the question, I don't think it's necessarily the federal government's primary responsibility, or that the federal government is primarily responsible for this, but they need to, it would have been much better if they had played a larger role with the tools they have available. I mean, just very, and that's going to continue to be the case over the next year. State governments are going to be strapped for cash in this next year due to this economic downturn, and without massive amounts of just money from the federal government to the states. The federal government can deficit spend, the states can't. The states are going to have a really hard time, not just getting the economy going again, but also continuing to respond to the pandemic in an effective manner.
We had someone, this is a great follow-up. I was wondering whether each state's pandemic response is associated more with the state governor versus the incumbent party.
Yeah, that's a good question. I mean, we saw early on that there was not a real partisan flavor to which state governors acted quickly and aggressively. Mike DeWine, who's a Republican, who's the governor of Ohio, was among, he might have been the first governor to shut down schools, for instance, or if not the first, he was among the first. Larry Hogan in Maryland, who's also a Republican, got out there pretty early and was very aggressive, along with some Democrats like Gavin Newsom in California and Cuomo in New York. So I do think a lot of it, it's a good question, because I do think a lot of it does depend on the particular individual in office at that time, in this case, because it is such a kind of personalized decision in one person in this instance. And we didn't see a real partisan flavor to things, but I think in the opening up phase, we did see more of a partisan based action, I guess you would say, in terms of opening states up rapidly. And going forward, I mean, the reason this hasn't really been polarized like almost everything else in the US is because some of those early governors were Republicans who were really aggressively acting. I wonder, as things kind of continue to go on, whether this will not become more polarized. So if we have a second wave in next winter or in the late fall, I wonder whether responses about, say, if the public health experts think more social distancing and shutting things down is necessary, I do maybe suspect that Republican states would be less likely to do that.
Lillard Richardson, our director of the School of Public Policy, wants to know a little bit more about the research behind the paper that you've been working on, and he wants to know if you examined responses by age group. Two groups seem most likely to move: young and those newly retired, by choice or not. So going back to that question about state reputations and how governors, how aggressive they were in their public health decisions. So did you look at age groups?
We didn't. We broke it down by people that were concerned about coronavirus versus those that weren't concerned. But like I said, like 80% of the sample was concerned. And then we broke it out among Democrats, Republicans, and independents. I think that is an astute observation that retirees, in addition to young people, are most likely to move. The sample that we had was an MTurk sample, which is going to have very few older people. It's going to be a much younger sample than a representative national sample. So we didn't break it down by age. That's a good idea, but I don't think we could do it with this data anyway. It's predominantly going to be on the younger side.
I want to remind everyone that we're taking questions in that Q&A chat box. Just ask your question and we'll get it to Chris about his recent work on state responses to COVID-19, state reputations, and long-term economic health. Chris, what are the broader implications of this research beyond COVID-19?
Yeah, well, the broader implications are, I mean, what states do matters for people's perceptions of them. And it's something that you don't really see. You do see it on the side of, well, we need to have tax cuts for businesses so businesses will locate here. We need to have taxes low so wealthy people will locate here. We need to, you do see that sort of thing. You don't really see it from the other side. Like what potentially stupid things are we doing that would give people a negative perception of our state. You know, and this becomes increasingly important as states, of course, compete for, like basically like Lillard said, you want your older retired people who just have a lot of disposable cash, can buy a new nice house, go out to restaurants and that sort of stuff. And then your younger people who are going to contribute to companies, start businesses, and do things like that. And states are going to continue to compete for these. There's also certain professions like doctors who have a lot of options about where to live. There's certain areas of our country that have shortages of physicians. They need to think about how their policies appear to physicians. Now, if you're a doctor and you're working your butt off fighting coronavirus, do you want to go to a state where the governor and maybe the state legislature don't appear to take this stuff seriously? And so people need to think about, people in government need to think about these types of perceptions in addition to the more direct economic dollars and cents perceptions, like what are our tax rates and things like that.
Mm-hmm. In some of your other research, you examine how state policy affects and responds to economic inequality. Do state COVID policies have implications for inequality, whether economic or racial, ethnic?
Yeah, they do in a lot of ways. I mean, first of all, any decisions that affect the economy are going to affect, you know, people differently. If you look at the folks who were put out of work by the shutdowns, I mean, it tended to be people who, it wasn't people who have PhDs, it wasn't people who have master's degrees. It, by and large, was working class people, disproportionately people of color were affected by the layoffs, but also affected by, they're more likely to work in the essential professions as well. So there's a lot of ways that these decisions about how to open the economy, when to open the economy, when to close the economy, affect different groups differently. And there's also the fact that different public health decisions affect different groups differently. So we've seen in this country that African Americans have been disproportionately basically killed by this virus. And so when policymakers are thinking about you know, what to do as far as the economy, what to do in terms of public health, they really ought to be thinking about the disparate impact that these policies and these choices will have on different groups.
Oh, this is an interesting question. This is a future applicant to the MPP program at Penn State, which we love to see. I'd like to know how you see the economic recovery on a national level, especially if there is not a national plan and each state is addressing reopening differently.
Yeah, that's a good question. I mean, I think there's a lot smarter people who know more about macroeconomics and stuff than I do that can probably answer the national piece of this. I mean, I think one thing that's going to happen, and I'm not sure everybody in Washington, D.C., and maybe some people in the White House understand this, but if you do not have massive fiscal stimulus via the state governments, in other words, if the federal government does not just give lots of money to the state governments, that's going to slow any economic recovery, because you're going to see teachers getting laid off. You're going to see firefighters getting laid off. You're going to see police getting laid off. You know, that's quite a juicy target right now in particular. And so you're going to see these, and the other thing is it's going to actually prolong the pandemic, which is itself going to slow the economic recovery, because we're not going to be able to hire contact tracers. We're not going to be able to do adequate testing and all these things. So one thing that will really not help and really will do great harm is if the federal government doesn't get its act together and start giving a lot of unrestricted money to the states quite soon.
You know, you do study how states respond to problems when the federal government fails. So an episode like this, what does this tell us about it?
Well, it tells us, excuse me, that the states can do a lot. You know, if we look at certain states that acted aggressively pretty early, I mean, California, Washington did a great job of kind of getting this thing under control pretty quickly. And that, in San Francisco and Seattle, they had great local public health departments, great university department partners, and things like that. Responses in other places haven't been quite as good, but they've been good, and then in other places they haven't been good. So the states can do some things, but the problem is we're just getting to the point now where states or a number of states anyway, not all states, are having adequate testing. I think Pennsylvania is an example of this. We hadn't had adequate testing until basically the last couple of weeks, as far as I understand it, according to the experts who study these things, and that is something where the federal government really could have helped. So the federal government just has vast resources and money that the states don't have. And, the federal government, if we're going to ever get serious about testing most people, at least periodically, contact tracing aggressively, all of that money to pay for that is going to have to come from the federal government, because the states simply aren't going to have it. So, and it's the same thing, and I've studied income inequality. The states can do a lot to address income inequality. They can address minimum wages, they can shape tax policies, they can do a lot. But really, the federal government has more control over more policies and more money, with which to address these things. So there's limits to what the states can do to address these big problems.
I've got a couple of really great questions here I want to get to. First, I think this is a good follow-up. Another one from one of our faculty members, Andy Fenelon. Is coronavirus an opportunity to shift some of the policy innovation burden back to the federal government from the states, but being squandered currently?
It would be an opportunity, depending on the people who are involved in the federal government. I won't name any particular names, but certainly in Congress and the White House right now, we haven't seen people who are intent on really tackling the long-term problems facing our nation, whether it be things like income inequality, racial divisions, you name it. In the last several years, really, Congress has barely been able to do the most basic tasks of governance, passing a budget and things like that. So yeah, there's a potential for an opportunity there, but I do think, like Andy said, it is, if we had a different person in the White House, I think you would have seen most likely a more aggressive response. And I think that would have been true of either Obama or George W. Bush. I think they would have probably gotten in there, jumped in with both feet a little more quickly.
And I want to get to Catherine Baumgardner, a director of professional development and student engagement, because she's asked a couple of questions, but I know a few you've already addressed. How might your research findings be used to bring people together around a response to not only pandemic, but other disruptions? In essence, neutralizing the potential conflict between public policy and civil liberty.
Yeah, well, we're seeing a lot of conflicts right now between public policy and civil liberty. How could it bring people together? I think one lesson from this episode is that a lot depends on the leadership of governors, of highly visible political actors, let's say that. This hasn't been too polarized. It hasn't been as polarized as you might think it would have been in this day and age. Let's put it like that. And that was because of certain governors like DeWine and Hogan, who were Republicans, who were visible, basically preventing it from becoming polarized. But it's easy to have things go that route and become very divisive if individual political leaders don't, in this case, step up and do the right thing. Or at least what the public health professionals said was the right thing. And that's one point to make, is like, we're not saying in the paper, people love social distancing, they love stay-at-home orders. I don't know about you, but I personally hate it. But I think people see a public health consensus that's also a consensus among elected officials, and they say, okay, that's what we need to do. They're very willing to go along with it. If you think about what we accomplished in this country from March to middle of May or whatever, with most people staying at home, not going to work, not driving far. It was quite amazing, actually. And part of the reason that was able to be accomplished was because it wasn't a polarized issue.
Lillard is following up with the Northeast urban core was hit the hardest early on, but now the per capita rates are increasing in many rural areas and southern states like Texas, Florida, and South Carolina. Knowing your past work on the patterns of inequality across these states and policies in those states, how does that change the nature of the pandemic at this stage?
That's a good question. I think a lot of those, if you just think about the states where these more rural southern states where you're having the cases spike now, I mean, they're going to have a less robust public health infrastructure, number one. There's probably going to be, not probably, there's going to be more inequalities in access to health care in a lot of these states. The other factor is you're going to be probably more likely to see, even if things get really bad in South Carolina, Georgia, it's questionable whether the governors in those states would be willing to aggressively embrace social distancing and stay-at-home orders and things like that, because they've been wanting to toe the line, with national Republicans. So that's also a concern. So yeah, the fact that it's spreading away from basically the wealthier states that have a pretty good public health infrastructure and greater state capacity to states with less of those things, and also states where people are going to want to appeal to national Republicans, the leaders anyway, that's going to be potentially a more problematic mix.
We have a question here about testing in Pennsylvania and available testing. I think that might be a question for next week when we talk to Selena Ortiz about Pennsylvania local officials' response to COVID-19. So that might be one that we
I'm going to pass on that
for her.
Yeah,
I think that might be one for next week when we continue this conversation. One thing I wanted to ask you about, Chris, this is specific to, and Selena just chimed in with happy to discuss, so that's great. We'll save that one for next week, and I hope that person joins us next week. One thing I wanted to ask you, Chris, this is definitely an unprecedented event that we're dealing with right now with this epidemic, but with something like this, we certainly have dealt with other crises in the past that have played a role in state reputations. Are there any other events that you can talk about that have we've seen sort of impacting the reputations, that have played into people's decisions as far as how they've decided to make those employment decisions and things like that?
Yeah, there's very little research on the individual side of this. There's more research on, why do businesses choose to locate in certain states? Why do, tax policy, regulatory policy, that sort of thing. But I mean, if you just think about, I grew up in New York State, and my father was in the Air Force in the 60s and late 60s and early 70s, and they lived in Texas. Some of the things my mother saw in Texas at that time, she didn't ever think about going back there, and she told me in no uncertain terms that you don't ever want to live in Texas. Some of the segregation and things of that nature.
Sure.
And so things like that make a big impression. I think in more recent years, think about what are some of the visible things that states have done. I mean, in some states like Wisconsin, North Carolina, you've had states basically, in some respects, turn their backs on democracy, make it a lot harder to vote,
right.
Undermine the will of the people in terms of election.
Labor issues, things like that.
Yeah, limiting the rights of people to collectively bargain. And actually, Michael Nelson and I have some other research on that sort of stuff. So, educated people, young people, educated people, they value expression, they value democracy. They're going to be less likely to move to states where those things are being infringed upon. And I think Georgia, what I saw last night, if you're into democracy, that's not a place you want to go. Now, some states, North Carolina, I did my PhD at UNC. It's a lovely state. It has fantastic beaches, nice mountains. So they're going to get some people because of that. But if you're Ohio, if you're Wisconsin, you don't have as much margin for error. No offense to my Badger people out there. I know there's some, but you just don't have as much margin of error. And so states need to be thinking about this. And the funny thing is, a lot of states who are engaging in these moves are the ones who claim to be most concerned about economic development. But in some ways, they're making their states very unattractive for smart, educated young people to move to.
Here's someone who's chiming in about Ohio and Governor DeWine, who it says restricted the sale of liquor to only Ohioans in 6 counties in eastern Ohio, saying this is necessary because of repeated instances of persons from Pennsylvania coming into these counties for the sole or main purpose of purchasing liquor. Do you foresee any lawsuits in the future regarding privileges and immunities clause in the U.S. Constitution?
Wow. Well, I'm no constitutional law expert, so I can't speak to the specifics. But I think somebody would have to, an individual who felt like they were wronged would probably have to sue, right?
Sure.
And I probably wouldn't bother with that myself. Fortunately, I live near Delaware, so we have no problem. But yes, I think one thing we should do though is in the future when there's any pandemic, we need to just ensure that the governor makes sure the liquor stores stay open. So you might want to fire off an email or a letter along those lines now.
You know, as far as your research with this paper with Michael Nelson, like where are you guys going from here? Will you be measuring the since you wrote this paper a little bit ago, now we've seen states begin to open up, the rephasing and the easing of restrictions. There could be times where states might modify the easing of their restrictions, and there could be possible changes in the way people feel about governors' actions. You know, might you revisit the research that you've done here?
Yeah, it would be possible to do. I mean, the thing, yeah, we don't know what's going to happen, right? I think the thing is, if there's a clear public health, the major implication is if there's a clear public health consensus and governors go against that consensus, it's going to hurt the willingness of many people anyway to live in that state compared to other states. Now, if there's not a clear consensus, and things have broken down, I think, a little bit in terms of consensus at this point. I mean, for a while there, even Trump was saying, we need to do the social distancing. Everybody just needs to stay at home. You know, in the last month and a half, the consensus, it's still like you need to be practicing social distancing, but it's not as clear as it once was. Now, if we get into the fall, I mean, and things rear up again and we have more cases exploding and they mandate social distances again, and that's kind of the public health consensus, and there's a clear message, I think we would see the same thing. When there's a consensus about what's good from scientists and from public health experts and doctors, and the government goes against that, I think you would find the same thing. I'm not going to promise that we'll do that study, but we might.
Here's another question from our faculty member. Do your Georgia and North Carolina examples, those 2 states are arguably getting more migrants than any other state, southern states. Does this suggest that these effects are happening on the margins, or is it really that Georgia and North Carolina are actually making fewer mistakes than a lot of other southern states?
These choices are happening on the margin. I mean, the number one, you know, a big thing is whether there's job growth in a state, right? So North Carolina and Georgia over the last 20 years or longer have had pretty rapid job growth compared to the rest of the U.S. So people are going to be more likely to move there. There's also, of course, the weather issue, people fleeing, and that gets into the retiree stuff that Lillard was talking about. People want to live in a place where it's warmer, typically these days, since we have widespread air conditioning. And so all those things matter. This is really something that this kind of thing is really going to matter at the margin, at least for this type of decision.
So how are researchers like yourself, faculty like you, able to work with the kind of statistics that are being provided with this crisis? From my understanding, it's not all consistent. with the statistics that you're being provided? Are
Yeah.
all states reporting a consistent set of statistics? What are you working with here?
Well, yeah, it's a good question. I'm not actually doing much directly with the coronavirus data, like the
Mm-hmm.
incidences, the deaths, and stuff
Mm-hmm.
like that myself. But from what I've read, it does seem like there's a lot of inconsistencies in what's reported. Fundamentally, there's just inconsistencies across states in the percentage of the population that's tested and who is tested. So comparing, case rates from state to state is really difficult to do because they're testing really different populations in a lot of instances. The other thing, some states are releasing data on different ethnic and racial groups. Other
Mm-hmm.
states aren't releasing data on different racial and ethnic groups. Now, at some point, we'll have those data, but right now, there's a lot of data that is not being made available, or even if it's made available, it's not really necessarily comparable.
And as well as the way some states report death has now changed as well. States like Colorado are
Yes.
reporting deaths due to COVID-19 or from COVID-19, or as a, it's
Yeah,
not
and
directly linked, so that their numbers are a little bit fewer. So those have changed as well. But how will this impact policymaking if we don't have a consistent set of statistics or findings for policymakers? This is problematic, no?
it is problematic. I mean, I think we're getting enough. There's enough measurement that we are able to kind of detect broad trends. And
Mm-hmm.
as long as states are consistent in how they're measuring it within their state over time, we'll still be able to measure the trends. We'll be a little bit off on the total numbers of cases and things like that. But next year or in 2 years, you're going to start to see studies come out where people look at and some people are already looking at excess deaths, like year over year, month to month. But there's enough data to probably inform decision making at a rough level. There's
Mm-hmm.
not enough good data necessarily to answer all of the questions that social scientists might have, and particularly that public health people, epidemiologists, people like that would have.
Chris, it doesn't look like we have any more questions in the queue right now, but as we wrap up our conversation, is there anything else that we want to note about this research? It sounds very interesting as we look at reopening these states and the reputations that people are and their perceptions of different states as they're looking at employment.
Yeah, I mean, I think number one, let me just say the article was published in the Journal of Behavioral Public Administration, which is an open access journal. So anybody can go on there and check out the article.
Mm-hmm.
And I'd recommend you do that. There's some nice graphs which really just show or figures that show the findings in a pretty concise way.
I think we've also tweeted it as well, so you can
Okay.
find that in our Twitter feed.
So check that out. I mean, I just ask you to think about your own perceptions of different states. Many people on this are themselves highly educated, highly mobile individuals. Are you more likely or less likely to think about moving to particular states when you see what the governor does in response to this pandemic, and more broadly in response to other problems?
Here's a question. This is a good one maybe to end on. Political science has long debated whether voters are knowledgeable enough to vote prospectively or retrospectively versus simple ideology. So what does your study suggest about how voters might respond to the pandemic? And I know you did look at different sets of voters as well.
Yeah, so we looked at Democrats, Republicans, and independents. I mean, I think Democrats are going to more harshly penalize governors who didn't mandate social distancing or who didn't stick with the public health consensus going forward than Republicans would be one implication. Now, the root of the question is this question of, are voters actually looking back at what happens? Are they thinking about just what's kind of happening now, or are they looking forward? If they are looking back, I think Democrats in particular, are going to penalize governors probably who who didn't mandate stay-at-home orders, who didn't do that sort of thing. Whereas for Republicans, it might be just the opposite. If you're a Republican living in a state where the Democrat took very aggressive action, mandating stay-at-home orders, I think you'd be less likely to vote for them. But we'll have to wait for the voting behavior specialists to actually do these studies.
And we did have someone ask about where they can find that article, and I will put that out on our Twitter account in a few minutes after we finish this conversation. So definitely check that out at PSU Public Policy. So I want to thank everyone for your great questions, and thank you to Chris Witko for your time today, Chris, and for discussing your recent research on state responses to COVID-19, state reputations, and long-term economic health. We hope you'll join us on Wednesday, June 17th at 2 o'clock for the next policy and the pandemic discussion, Pennsylvania local officials' response to coronavirus, with Selena Ortiz, Assistant Professor of Health Policy Administration and Demography at Penn State. I'm Whitney Sheridan. For all of us with the School of Public Policy, thanks so much for watching and have a great day.